You go to your doctor's office.
We're done with your blood pressure and your vitals. I'm going to have you complete this depression screening questionnaire. You're going to answer to both of these questions. So based on your answers to this questionnaire, I'm going to have you fill out another questionnaire which has 7 questions and another one at the top. I'm going to put these answers into your chart. I'll give Dr. Jones your answers and she'll be in shortly with you to discuss them.
Okay.
So it's good to see you again. I understand that you're coming in for a physical. Thanks for filling out our form. Looking at this, it looks like you've been experiencing some depression that's really affecting your life.
Yeah.
From your answers, it looks like you have moderate depression. Can you tell me more about how you've been feeling lately?
I've been really worried about work. My department let someone go a month ago, and since then I've been worried that I might get fired. They put the new guy on the project instead of me. It's been hard to concentrate. I can't relax. I think about work a lot when I'm home, and sometimes it keeps me up at night.
I'm sorry to hear that things have been so difficult. How long do you think this has been going on for?
For about a month.
Are there some days that are better?
The doctor and you continue to talk.
We have a nurse specially trained in depression on our team that can talk to you more. Based on what you've told me, it sounds like it might be helpful to learn more about what depression is and some options for treatment. Would you be willing to do this?
Yeah. The doctor leaves the exam room and lets the nurse know that you would like to learn more about depression.
Hi, I'm Mary. I'm one of the nurses. I was talking to Dr. Jones and she wanted me to talk with you. It sounds like you've been having some feelings of depression. Is now an okay time to talk further about that?
Yeah.
A lot of people have feelings of depression, but this isn't something we want you to have to suffer through alone. Part of the reason she wanted me to come in was to talk through some ways to help you feel better.
The nurse talks to you more about what depression is and how it can be managed. She gives you a handout to take home that has more information about physical problems, behaviors, and thoughts and feelings associated with depression. The handout also contains some pleasant activities to try and a weekly plan detailing what you will do, when you will do it, and how it made you feel.
I have a few suggestions I'd like you to try. I would suggest exercising a few times a week and see if that helps you feel better. Would that be something you would want to try?
Sure.
Another thing to try is to plan your worry, which is better than your brain deciding on its own to worry when you're about to go to sleep. What do you think about writing down what's bothering you for 15 minutes, and then setting it aside and moving on with your day?
Yeah, I'd like to try that.
I will follow up with you in a week or two on the phone, depending on your availability. We're going to go through how things went for you, how you're feeling, what things worked, what things didn't work, and if there are other things that you want to try. Is that okay with you?
Yeah, that sounds great. In 2 weeks, the nurse gives you a call to see how you're feeling.